Today, we are going to discuss about Bruxism. What is Bruxism? So today, we are going to discuss about the definition, the etiology, clinical features, diagnosis and treatment of Bruxism. Bruxism can be defined as grinding of teeth for non-functional purpose. It is usually seen during the night. If the grinding of teeth is seen during the daytime, then it's called as bruxomania. So what is the etiology of bruxism? A. Psychological and emotional stress are thought to be the causative factor. B. The occlusal interference or discrepancy between the centric occlusion and centric relation is thought to be another contributing factor. C. Pericoronitis and periodontal pain is thought to be a trigger factor for bruxism. So what are the clinical features of bruxism? Number one, the occlusal wear facets on the teeth indicates the bruxism. B. Fracture of teeth and restorations. C. The mobility of the teeth. D. The tenderness and hypertrophy of masticatory muscles. E. The TMJ pain and discomfort. So how do we diagnose the bruxism? Number one is history. A thorough history reveals night grinding of the patient. B. The clinical examination. Check for occlusal wear facets and occlusal prematurities. C is electromyographic examination to check for the hyperactivity of the muscles of mastication. So how do we treat bruxism? One, psychological counseling. If the bruxism is due to emotional and psychological disturbances. Number two is hypnosis and massaging of the muscles to relieve muscle tension. Number three, occlusal adjustments to eliminate the occlusal prematurities. Number four, the occlusal splint or night guard to prevent occlusal wear. So under the heading of bruxism, we studied about the definition, the etiology, the clinical features, diagnosis and the treatment. Thank you. Keep watching these videos on YouTube and please subscribe to my channel for further updates about orthodontics and orthodontic classes.